So Grammy winner Meghan Trainor just recently talked about how nurses made her feel bad for taking antidepressants while pregnant. She says that after her son was delivered, the nurses were saying the baby was sleepy and having trouble waking up for feedings. So they asked her if she had taken antidepressants. She said yes, but a very low dose. But it was implied that that was the reason why the baby was having what they thought were issues. So let's chat about this. What these nurses were likely referring to is something called poor neonatal adaptation syndrome, or PNAS. And PNAS is also known as neonatal withdrawal syndrome and serotonin discontinuation syndrome. And this can occur in newborns, particularly those that were exposed to antidepressants in the third trimester of pregnancy. Symptoms of PNAS in a newborn can include poor muscle tone, tremors, jitteriness, irritability, seizures, feeding difficulties, sleep disturbances, hypoglycemia, and respiratory distress. Symptoms of PNAS in a neonate typically start within a few hours after delivery and can last for a few days up to a couple weeks after delivery. But overall, in a majority of neonates who do have this PNAS, the symptoms are mild and self-limiting, meaning that they're not that significant and they resolve without any intervention. It is important that your obstetrical care provider, obviously, and the pediatricians know if you are taking antidepressants in pregnancy so that they can observe the neonate for any signs of PNAS. But it is not recommended to discontinue your antidepressant or taper it down in the third trimester in anticipation for delivery. Now, the potential risk for a neonate developing PNAS after exposure to antidepressants in utero must be weighed against any risk that might occur due to untreated or undertreated depression during the pregnancy and in the postpartum period. Untreated depression in the pregnancy can affect the neonate by causing growth restriction or growth problems during the pregnancy. It could cause preterm labor or preterm birth. It can cause the baby to be of low birth weight, and it could also cause other health complications for the neonate after birth. It can also cause, in the child as the child gets older, more emotional and behavioral problems as well. Now, the risk of not having your depression treated in pregnancy can affect you in numerous ways, including just not being healthy overall, being depressed, not eating well, not sleeping, not taking care of yourself, not bonding with the baby. And that can also greatly increase your risk for postpartum depression and postpartum psychosis. So there are definitely effects of untreated or undertreated depression in pregnancy on both the pregnant individual and the neonate. Psychiatric disorders in pregnancy don't magically disappear when someone's pregnant, meaning that they don't need to take medication any longer. So this practice of any provider or anyone telling a pregnant individual to come off their medications for the sake of the pregnancy needs to stop. A mentally and emotionally healthy pregnant individual is essential for a healthy pregnancy and neonate.